people have enrolled to provide continuing support. So the other part of this is health literacy. The law doesn't say a lot about that. It just makes these navigators available. Just because I have insurance doesn't mean I know when to go to my primary care provider versus the emergency room. It doesn't mean I understand everything that's being thrown at me. That's true no matter what your educational attainment is. So navigators, the model I just described to you, that's exactly what in-person assisters are. The difference is in-person assisters are state funded. So we've got two programs with funding. The only difference is where their funding comes from. Everything else remains the same. All of those duties remain the same. So the Navigator grant is currently, the request for proposals is currently available from the federal government. The in-person assister request for proposals will be available in the next couple of days. I don't know why I was going to look at my watch. In the next couple of days from the state, from the Department of Insurance specifically. The in-person assister is, truthfully going to be the best option if you work for an agency who you think might be appropriate to apply for this. In-person assisters, there's a lot more money for that. There's only $2.3 million coming to Illinois for navigators. When you think about how many people need assistance, $2.3 million is not very much. So then we've got this third group, certified application counselors. These are volunteers. These are people who will not receive funding, but for one reason or another want to learn how to do what navigators and in-person assisters do. So navigators and in-person assisters will be required to go through a 3-day training, in-person intensive training that's actually being planned by professors from the UIC School of Public Health. These trainings will be facilitated throughout the state. At the end, there will be a test. So in order to actually be a navigator and in-person assister to receive that funding, you have to pass that test. Certified application counselors will go through the same training and pass the same test, they just won't get the money. So if you talk to people from Health and Human Services, they'll tell you certified application counselors are people who didn't want to apply for funding. We all know they will be the people who don't get the funding. So we are really encouraging anyone who interacts with individuals in the community who is providing any sort of advice on accessing public health insurance or other programs to become a certified application counselor. It's kind of like being an All Kids application agent without the money, which is actually being an All Kids application agent now. It's a really important opportunity, a really good opportunity to learn how these systems work and learn the best way to interact with clients and help them through this process. Certainly, if you do not become a certified application counselor, or if you want to, it's still helpful to know who the navigators and in-person assisters are. So the last thing that I'm going to pass around, and if it doesn't make it all the way around, we can move it up to the front, is a sign-in sheet. If you give me your name and your email address, I will add you to our Affordable Care Act listserv. They were relatively infrequent, now we're getting close to one a month, because there's a lot happening. But we'll let you know who navigators are, we'll let you know when the trainings will be taking place, and share all kinds of other information with you. So I'll pass that around. That is the end of what I planned to say. I included a bunch of resources here in case you're interested in learning more about the law. Any questions?
Yes. I wonder, will there be an adequate provider pool? Or will there be an extended wait time given the increase in...
So that's a great question. And the question was, will there be an adequate provider pool or an extended wait time? The answer is complex. The law tries to address the provider problem, right? Especially with Medicaid. With private health insurance, we don't think there will be a problem because providers accepting private health insurance get paid pretty adequately usually. I don't think any of us have really experienced a shortage in providers for our private health insurance. The problem is obviously Medicaid, right? And that's true in every state, not just Illinois. So the law tried to address that, but it could only do so much as a federal law. So it puts in place a lot of programs around medical students, so encouraging medical students to become primary care providers rather than specialists by having loan forgiveness, by having special programs, things like that. Those obviously will take many years to have a real effect. The other thing that it's done has looked at Medicaid reimbursement. So actually right now, calendar years 2013 and 2014, Medicaid primary care providers are receiving or will receive an enhanced reimbursement. So they're being reimbursed at the Medicare rate which is 60% higher than Medicaid. So this is something that the federal government is paying, not the state of Illinois, which is an important detail. And it will be sent to providers as a bundled payment. This is going to like primary care providers, family physicians, general internists, pediatricians, board certified primary care providers, or anyone who billed at least 60% of their Medicaid billing in 2012 for primary care codes, right? So this is where we could see some nurses, maybe even some licensed clinical social workers, though not likely, or not many. But this is where we could see some other folks who are not board certified physicians receiving the enhanced match. Again, this is only a small drop in the pond. It's only a very small way of fixing what's happening. So now the state is looking at other opportunities. They've established 2 different task forces, they being the governor's office. The governor's office runs the Healthcare Reform Implementation Council. That council has established a small task force that's like government agency folks who are going to look at short-term solutions to the provider problem. And then they're working to convene a larger task force that will be agency folks, advocates, providers, kind of the hodgepodge of people who really know about this issue, to think about long-term solutions. So people are thinking about it. In the case of Medicare or Medicaid, we'll see what happens. We already don't have enough providers to meet demand. The hope is that first 3 years with the federal government paying the bills, at least for the new population, we might get improved networks. This is another part of the reason that the state has been pushing coordinated care. While the law doesn't require coordinated care, the state saw moving folks into a coordinated care system as a way to help solve the provider problem, right? Coordinated care is always a good idea on paper. It remains to be seen whether or not it was a good idea in practice. But that is the question that comes up every time when you say 600,000 new people in Medicaid. Most people panic if they know anything about Medicaid, and it's not unfounded. So, complex answer.
I have a question, okay?
Okay. Go ahead. Oh, did you have a question, sir?
I did. Actually, two. The exchanges. I heard a report on the radio that Obama was considering pushing the exchanges to 2015. Have you heard anything about that?
So, yes, the marketplaces themselves will open October 1st of 2013. That's not changing. What has been pushed till 2015 is this smaller marketplace called the Shop Exchange. It is a smaller marketplace that would have been available to small businesses. So what would have happened is small businesses, meaning those businesses with 25 employees or less, who use the marketplace actually would have been able to tell their employees, go to the Shop Exchange and find the plan that's right for you, rather than saying, this is the plan you have. And employees would have gone to this kind of smaller marketplace and they would have shopped around. They just don't have enough time to develop that and the larger marketplaces because we were delayed by the Supreme Court decision and then the election. So those shop exchanges are being pushed off until 2015. Small businesses will still be able to use the marketplace, but it'll feel a lot more like it does now. So what will happen is, for example, my executive director will go online, she will go to the marketplace, she will find the plan that she likes, and then we'll all enroll in that plan through the marketplace. We won't get to choose our plan.
And pharmacy. Let me do a quick example. The person earning $20,000 is schizophrenic, gets her medication from a doctor in a clinic in samples, has been not schizophrenic for 10 years. What happens next?
That's a great question. So I can try to answer that broadly. So the question was, what happens to prescription coverage, especially for somebody receiving samples? As part of the essential health benefits, every plan must cover prescription drugs. So we know that in 2014, all of our plans that are available, including those plans that are going to be available to low-income individuals, will cover prescriptions. I don't know exactly the exact details of the coverage for the plan in Illinois. I do know that it will cover psychotropic medications. because this law extends the parity requirement to cover all plans, not just large group plans. The problem will be Medicaid, which is where a lot of the type of people you're discussing would fall. The utilization controls currently in place for Medicaid will continue to exist. So if somebody enrolls in Medicaid, they still have that 4 prescription limit. That's not going to go away, unfortunately. So what happens really depends on what kind of coverage you enroll in, but what we know is everybody will have access to prescription benefits for both medical and kind of mental and behavioral health prescriptions.
My only concern about
Okay,
it
we're
is,
kind of running late on time.
Okay.
Sorry to cut you off, but it's 7 and the other group's ready to come in. So I appreciate the active discussion, but we're going to have to end it. Everyone